Pregnancy starts at conception, but the commonly used dating for pregnancy begins with the first day of the last menstrual period (LMP). Here's a detailed explanation of how pregnancy is typically dated and when it actually begins. 1. Conception. What it is. Conception is the moment when a sperm fertilizes an egg, creating a zygote. This usually happens in the fallopian tube. Timing. Conception typically occurs around the time of ovulation, which is approximately midway through the menstrual cycle. 2. Pregnancy dating. Medical standard. In medical practice, pregnancy is generally dated from the first day of the last menstrual period (LMP). This is because it's often difficult to pinpoint the exact date of conception. Weeks of pregnancy. Pregnancy is calculated as lasting about 40 weeks from the first day of the LMP, which translates to roughly 38 weeks from conception. This is based on a standard 28-day menstrual cycle with ovulation occurring around day 14.3. Key milestone is ovulation and conception. Ovulation typically occurs about 14 days before the start of the next period. Conception usually occurs within 24 hours of ovulation. Implantation. About 6 to 10 days after conception, the fertilized egg implants into the uterine lining, marking the beginning of pregnancy in terms of biological changes. 4. Pregnancy confirmation. Pregnancy tests. After implantation, the body starts producing human chorionic gonadotropin (HCG), a hormone detectable by pregnancy tests. This generally happens about 1 to 2 weeks after implantation. Ultrasound. An ultrasound can provide a more precise dating of pregnancy, particularly if there is uncertainty about the LMP or if there are irregular cycles. 5. Gestational age versus fertilization age. A gestational age refers to the age of the pregnancy calculated from the LMP. This is the most common way to measure pregnancy duration. Fertilization age refers to the age of the embryo, fetus starting from the date of conception. It is typically about 2 weeks less than the gestational age. Summer pregnancy start date. From a medical standpoint, pregnancy is considered to begin at the start of the last menstrual period (LMP), even though conception occurs later. Conception timing. Conception typically occurs around ovulation, which is roughly in the middle of the menstrual cycle. Understanding these distinctions helps in accurately determining gestational age and planning prenatal care. If there are any uncertainties or specific concerns, consulting a healthcare provider can offer personalized insights and confirmation.